Hello, my name is Ariel Yusupov, and I'm the CEO and founder of FIG, or Factor-Induced Gene Therapeutics. We're developing a gene therapy that hijacks overexpressed transcription factors in cancer to drive a multimodal immunotherapy. Essentially, we use cancer against itself. One of the main problems in cancer treatment is that many of them make things worse shortly after making it better. Most cancers are driven by overexpression of transcription factors, which bind to target sequences in DNA and transcribe genes that cause the cancer to divide. For example, in prostate cancer, the top cancer in men, is driven by the androgen receptor. In breast cancer, the top cancer in women, it's driven by the estrogen or progesterone receptors. Thus, the number one medical treatment strategy is to inhibit these transcription factors. Inhibitors of the androgen receptor make over $20 billion in revenue each year. The problem with this approach, however, is that inhibition of these transcription factors causes development of resistance within 1 to 2 years. A second big problem in cancer therapy is that cancer is a master immune evader. Although immunotherapy is a promising solution, you may have heard of CAR T, CAR NK, cytokine therapies, neoantigen cancer vaccines, you name it. They have all failed and will keep failing for solid tumors because of the immunosuppressive tumor microenvironment. Cancer immunotherapy for solid tumors can only succeed in a multimodal approach that addresses multiple key immunosuppressive factors in addition to stimulating an anti-tumor immune response. Thankfully, we have developed a solution to both problems. Rather than inhibit the cancer-causing transcription factors and induce resistance, we harness their function to transcribe genes. We have designed a proprietary promoter enhancer sequence custom to multiple cancers that recruits their respective cancer-causing transcription factors to bind and drive multiple therapeutic genes. The transcription factors drive multiple genes that both recruit potent anti-tumor immune cells to the site of the tumor and also inhibits multiple key immunosuppressive factors released by the cancer cells in the tumor microenvironment. Our polynucleotide therapy, which we have named the stealth gene therapy because the cancer doesn't know it's driving its own demise, is encapsulated in a lipid nanoparticle and injected directly into tumors biweekly under ultrasound or MRI guidance as a neoadjuvant prior to surgery. And then we have transformed a cancer cell into a machine that now trains the immune system to kill cancer cells locally and wherever they may be hiding. Because the therapy is driven by transcription factors elevated in cancer, any transfected non-cancer cells make very little therapeutic. We can promiscuously inject the entire tissue and get cancer specificity despite non-specific delivery. And here's our team. I personally have over a decade of expertise in prostate cancer research, as well as years of experience at Pfizer and Johnson & Johnson, leading RNA and gene therapeutics development from discovery all the way to phase 3. Our team also includes leaders from Columbia, Memorial Sloan Kettering Cancer Center, Cleveland Clinic, as well as IMVACS, all of whom have particular expertise in prostate cancer and immunotherapy. 3 of them have led multiple clinical trials, including Dr. Dallas, who is currently leading a CD40 ligand direct injection immunotherapy trial for prostate cancer at MSKCC. Although our technology is in development for multiple cancers, our focus is high-risk localized prostate cancer, which makes up about a quarter of all prostate cancer patients, because 50% or 33,000 patients each year have recurrence of their cancer after standard therapy, which is prostatectomy or radiation. Next, they receive castration or AR inhibition therapy that quickly develops resistance within 1 to 2 years. Our stealth gene therapy can delay or eliminate the need for this treatment. If successful, we may be able to acquire a significant portion of the $20 billion per year market share from these castration drugs. Assuming 50% of patients try our treatment in the first year, 6 to 10 injections bi-weekly prior to prostatectomy, and $15,000 of revenue per treatment. all of which are pretty modest assumptions. Our projected first-year revenue is between $3 to $5 billion. Here's our timeline for the next few years. Over the next several months, we will be finalizing our lead candidates, which will be encapsulated in a lipid nanoparticle by our partners at Aquitas Therapeutics for in vivo studies. This first milestone, which would be about $750,000 in total, will be funded by our current pre-seed round and our phase 1 SBIR grant, which was submitted last month. Next, we will be raising $8.5 million in our seed round in 2025 to fund IND-enabling tox and efficacy studies, as well as analytical development. Once IND is granted, we will start recruiting, hopefully by the end of 2026, for clinical trials, which will be funded by our Series A. If all goes well, we believe an exit is possible as early as mid-2027. As mentioned, for our funding plan, we need $750,000 for our first milestone, which is lead selection. We have recently applied for a non-dilutive SBIR phase 1 grant of up to $400,000. We're raising $400,000 in our current pre-seed round and already have committed investors and about 20% raised. We plan a seed round for $8.5 million to fund IND-enabling efficacy and tox studies and analytical development in 2025. In 2026, we plan a Series A round, which should cover our phase 1, 2, and possibly 3 clinical trials, and we will be taking full advantage of non-dilutive grant opportunities, for example, the phase 2 SBIR of $2 million in 2026 as well. In summary, our multimodal stealth gene therapy hijacks elevated transcription factors in cancer to drive a multimodal immunotherapy. It addresses the problem of the tumor microenvironment that past and current cancer immunotherapies have failed to do in solid tumors. It allows for delay or even elimination of castration therapy for prostate cancer, which creates an improved quality of life. Our therapy actually works better in the presence of ligands such as androgen. There's minimal systemic toxicity. There's tumor specificity with non-specific delivery. And there's strong potential with expansion to other cancers. Our patent and development covers breast, melanoma, pancreatic, and many other cancers that are driven by overexpressed transcription factors. Thank you, and please feel free to reach out to me at any time. I look forward to meeting you.